But that also gets dangerous because now you get patients who bring in these AI or these even just filtered pictures of themselves. Like, this is how I want to look like. And then there's little things that people don't realize is that if you've got a smartphone and you're taking a selfie, studies show that selfie will make your nose look 30% bigger than it really is.
What?
Yes, 30% bigger. And so some people, they're taking selfies, they're like, I want to get a nose job. And it's like, no, it's because it's your phone's making your nose look 30% larger than it is. Take a picture from 5 feet away with the rear-facing camera, then see if you like your nose, because you probably will like it a lot more.
Thank you to Mud Water for sponsoring this episode of the show. You know, guys, I cannot believe Mud Water decided to come as a sponsor onto the show because I absolutely love this product and have been using this product for quite some time. Mud Water tastes like chai. So there's cacao and chai. There's a little bit of caffeine. It's amazing warm. It helps me focus. It has functional mushrooms in it, a fraction of the caffeine. You've absolutely got to try this. If I don't want to have a cup of coffee in the afternoon, I have been using Mud Water. I heard it first from a former Navy SEAL friend of mine. It's 100% USDA certified organic, non-GMO, gluten-free, vegan, and kosher. Mud Water also donates to support psychedelic research. And best yet, you can try Mud Water now for $29. That's less than $1 a cup. Go to mudwater.com/Dr. Lyon. That's mudwater.com/Dr. Lyon. And you will get yours for $29. Tastes amazing. Dr. Anthony Youn, thank you so much for joining me in person.
I know. I appreciate it. Thank you so much for having me.
Yeah, long time coming.
I know. We've known each other for many years, and this is, I think, our first time that we can actually do it. Did you do my podcast? You may have back in the day.
Yeah, probably.
If you did. It's been years.
5 years ago,
something
maybe.
Like that. Yeah. A lot has changed since then.
Yes, it has. And I'm so grateful to have you on. And there's a couple reasons. Well, number one, you're an amazing human, an amazing surgeon. And then the other thing is you also have a very interesting perspective on plastic surgery. Mm-hmm. Now, this is a medical show, health and wellness show, and people feel as if there's this huge dichotomy. And I'm sure you get this a lot. Oh, yeah. So they're saying, well, Dr. G, you're talking about health, but now you're talking about plastic surgery. You're going to tell us about injections, et cetera, et cetera. Do you get those questions a lot? Because you're called the holistic plastic surgeon.
Yeah. Is that a misnomer? Is that kind of an oxymoron?
That's exactly what I was thinking.
So can you be a plastic surgeon and still be holistic or be a doctor who promotes overall health and wellness? And I think the answer is yes. And I really think it's this idea of holistic plastic surgery, for me, is using plastic surgery as a last resort. You know, you and I both know a lot of healthcare influencers who, you know, they speak great stuff about food, about environment, about activity, yet we know they get Botox, we know they've had surgery before. And I really think it's using that as a last resort and using it in a way that I think is very, how would I describe it? I mean, it's using it in a way where you are really still focused on the patient's overall well-being first, because there are a lot of benefits that you can get from cosmetic treatments. But once again, if you can do that naturally, then obviously that's the way you want to go.
And at some point, you can't do it naturally.
Yes. And so the book, you know, there's a term I come up with called Autojuvenation. And it's this belief that I have, and I think it's true, that we all have innate regenerative abilities to turn back the clock naturally. But we have to unlock that with what we eat, with when we eat, with nutritional supplements, with skincare and non-invasive treatments. And I really believe that if you do focus on those 5 things, that the vast majority of people can turn back the clock. They can look 5, 10 years younger, and hopefully maybe not feel like they need to go under the knife.
And this is an interesting perspective because it takes a lot to become a plastic surgeon. And
yeah, you know, with your husband going through.
Yes.
Yeah.
And I do want to, I would love for you to highlight a little bit of the training because, you know, someone had sent me an Instagram. People ask about the podcast all the time. And I got one recommendation from a friend of mine and it said, world renowned. I don't know if it was facial reconstruction or surgeon, but I looked deeper and they weren't actually a board certified plastic surgeon.
Yeah.
There were things that were really concerning. And my biggest concern is if someone undergoes plastic surgery and there is an emergency, because surgery is not without risk, even though I was reading up on a lot of the history of plastic surgery and liposuction, a lot of people died. It was originally extremely risky.
Yeah. They call it dry liposuction, where they just make an incision, start sucking fat out of somebody, and they would have horrible bleeding afterwards.
And they would die. Yeah. It was a very risky procedure. But it's still, now obviously it's much safer and it's not without risk. And if something were to go wrong, you want someone who is surgically trained in a way that can manage that.
Yeah, one of the things I tell my patients and my followers is that, any plastic surgeon or quote unquote cosmetic surgeon can get a decent result on a patient. But really, I feel like the quality of the doctor is not how many good results they get, but how do they treat a patient who has a complication, And unfortunately, I hear so many stories in my area as well as nationwide about surgeons who operate on patients, they develop a complication, and the surgeon literally abandons them. They walk away. It's the same thing that you see when people go overseas. They have plastic surgery, they come back to the United States, they've got drains still sticking out of them.
And that's the medical tourism. Actually, that was on my list. I was curious as to this medical tourism that is happening.
Yeah, so really, I think the true test of how good a doctor is, how good a plastic surgeon is how do they treat their complications and can they treat them? And that's really how I look at it. I get doctors you hear and they brag about how many great results they get. And some of them will lie and say, oh, I don't get hardly any complications. And it's not true, because if you don't get complications, it's not that you are that good, it's that you just haven't operated enough. That's really what it comes down to.
That is a really good point. And you're not saying that it's not an if, it's a when. And it's the amount of volume. And really looking at a good surgeon is how are they going to be able to deal with not what goes right, but potentially what goes wrong. And
it's also true that there are studies, there was a really interesting book by Dr. Atul Gawande, you may have read it, Complications, where he actually looked at studies of what surgeons had the best outcomes. And it really does come down to those surgeons that do the same operation day after day after day after day had better outcomes than those surgeons who are kind of like jack of all trades. It used to be when I went through my training, plastic surgeons, they were kind of community plastic surgeons. They would do cleft lip and palates. They would do burn care. They would do cosmetic surgery. They would do reconstruction from breast cancer and other types of cancers. And they would do hand surgery even. And today, the field is so specialized that you really do want to ideally choose a surgeon that really does a total of like maybe a dozen or 15 operations. Because the more they do of that operation, definitely the better outcome in general the patients have.
That's an excellent point. And to become a board certified plastic surgeon, tell me about the length of time, the hours, because again, we have to understand that someone could call themselves a plastic surgeon. Doesn't mean that they are board certified. They might be a cosmetic surgeon. They might be a dermatologic facial surgeon. There's all different types.
So I can make up my own board of Dr. Youn's board of awesome cosmetic plastic surgeons, and I can certify whoever I want. There's no law against it. So in order to become a true board certified plastic surgeon, where you're certified by the American Board of Plastic Surgery, and this is what I went through, you need to go through 4 years of medical school. You need to then go through at least 3 years of general surgery residency training. And then when I went through, you only had to do 2 years of plastic surgery, but now you're required to do 3 years of plastic surgery residency. And then a good portion of those will then do a fellowship afterwards. So I did medical school at Michigan State University. I then did 3 years of general surgery residency at Michigan State. I did 2 years of plastic surgery. And then I spent a year out in Beverly Hills with the top plastic surgeon out there, where I did a 1-year fellowship, which essentially was like a apprenticeship underneath him, where you kind of learn the tools of the trade. And then I started my own practice.
I love it. So you are in no shortage of training.
And then you got to do all the darn testing. You've got the written and oral exams where like a third of the doctors fail some of those. So it's a long haul. And, I've got 2 kids, and both of them, they're like, oh, should I be a doctor? I'm like, only if you really want to do that, because it's a long, long haul. And
does the field of plastic surgery change rapidly?
It has been. Yeah. Just because all the treatments now, they're so different. Even 10 years ago, with a lot of the cosmetic treatments that we have now, surgery doesn't change that much, because the body itself, when you cut the body, like if let's say a tummy tuck where you're moving excess skin from the tummy, I mean, really, you cut the skin out. There's no other way to do that. What is really changing are the non-invasive and minimally invasive options. And that's where it's so exciting. Because, when I first started my residency, we had Botox and they had collagen as a filler, and that's it. And
really, people, they were injecting straight collagen, or was
it? Yeah. Collagen was the first filler. Yeah.
Oh my gosh.
Yeah, but it only lasted a couple of months. And for a while, for most of the time it was available, you had to do skin testing for it beforehand to make sure you didn't react to it. Now there's like such a plethora of non-invasive and minimally invasive options that it's really exciting. Actually, it's a really exciting time to get older. And so, people say what do you think about the whole aging process? And the way I try to look at it is a blessing to get older because if you don't, then, what's the alternative? You're in the ground. We don't want that.
No.
But
it's coming for all of us, but we're definitely not in a rush.
But it's an exciting time to be able to fight that every step of the way because we have so many options available. Was
there a moment in time where you were operating? Because again, your books, this is your fourth book, Younger for Life. You've gone through a series of, again, you're more holistic in nature. Was there a moment in time where you were operating on someone, and you've been in practice how long?
Almost 20 years.
20 years.
Yeah.
Where you just said, this doesn't feel good. I'm doing these invasive, because it is no joke, the recovery from surgery in general.
So I had, and the reason why I've gone in this direction and the idea even behind the whole book was, I thought that I had hit the pinnacle of success in my practice. And it was many years into practice where, I started out my practice back in 2004. I had sent letters to 25 surgeons in town, asking them for a job. Hey, can you take me under your wing? And I got 0 offers. And so I went into town in Metro Detroit deciding that, if nobody's going to help me, then I'm going to take their business from them. And so I worked my tail
off, Tony.
So I worked my tail off to establish my practice. I was working 7 days a week for years. And, in plastic surgery, really in surgery, we look in some ways, there's certain operations that each surgeon does that's kind of like the pinnacle of success, and in residency, you try to do those operations because you're so lucky if you can scrub into those. So if you're a general surgeon, that operation is the Whipple. Whipple, this is a 10-hour operation, cancer operation, and if you're so lucky to scrub into a Whipple, then you have made it. In plastic surgery, that operation is probably the facelift, because patients may trust almost anybody to do their liposuction, but man, if they're going to trust you to do their facelift, you've got to be pretty darn good. So for many years, Gabrielle, I actually gauged the success of my practice on how many facelifts I was doing. And I got to a point in my practice where I had a 1.5 year waiting list. I'd had a couple of books had come out already. And I thought that I had hit the pinnacle of success. But I was still a cut for a surgeon at that time. My goal was to operate on people. And they would come in yeah, let's talk about surgery. And then I had a patient who I did a facelift on, and I operated on her on a Thursday. She had a facelift. I saw her the next morning. She looked great. And then that weekend, I basically hung out with the kids and no big deal. And I came back to the office that following Monday morning, and I had a note on my desk from that patient's daughter. And the question that she left me was, why did my mom die? That patient who I operated on died over the weekend. And it sent me reeling. As a physician, that's the worst thing you could ever think about. So, what it made me realize, in plastic surgery and...
Well, what happened, but why?
I'll explain.
Okay, everyone is listening going...
It made me realize that we take people who are healthy, we make them unhealthy with the belief that they're going to be healthy again afterwards, okay? And that's what we do whenever we operate on somebody as this elective operation. So that whole thing, it sent me into an absolute tizzy. When I found this out, I'm on the phone with her daughter. My heart sank. I felt nauseous, and I broke out into a sweat. And I spent the next several months trying to figure out what the heck happened and how could I have prevented this. So I started looking at all the medications that she was on, everything that she had gotten in the operating room. There was nothing that I could have done that could have prevented this. It turns out she had a massive heart attack. But I got her cleared by a cardiologist 2 months prior to her operation. She had a stress test and everything. So literally the only thing I could have done to prevent her dying is just not operate on her. And maybe with with how her heart was, she would have died from something else. I don't know. But still, I still today blame myself for this. And so that really got me realizing, for a while I thought about quitting plastic surgery. I thought about quitting medicine altogether. And then I realized that I had to look at this from a different perspective of like, how can I take this horrible tragedy and create something right out of it? And that became this idea of autojuvenation. I started reading books from a lot of our friends and mentors. I started realizing there was so much about the field, about really medicine and healthcare that I didn't know, that I wasn't taught in medical school. And I started reading books from nutritionists, from naturopaths, from chiropractors, from other physicians. And I started creating this whole idea, this concept of autojuvenation, and realizing that there was so much that I wasn't taught, but I could use this information to help other people to look and feel their best by improving their health, including the health of their skin.
Do you think eventually you will not operate? Thank you to PaleoValley for sponsoring this episode of the show. You guys have heard me mention PaleoValley beef sticks many times, and that is because it is one of our absolute favorite snacks of all time. I do not say that lightly. These beef sticks are 100% grass-fed, grass-finished, by the way. They also have pork, they also have turkey, and these are all fermented sticks that make them extremely unusual because they have probiotics and postbiotics because of the fermentation process. Again, they taste amazing. They have high quality proteins, vitamin and minerals. Oftentimes we're turning away from packaged food, but let's face it, we live in a fast-paced environment and we have to be able to have food that we can grab. These sticks are it. You can get 15% off by going to PaleoValley.com/Dr. Lyon. That's PaleoValley.com/Dr. Lyon. And you can choose a whole host of flavors and options.
Yes. Because even now, there are these surgeons who, I have friends of mine who love being in the operating room.
Yeah.
And
my husband loves it.
Yeah. And for me, I don't enjoy being there because the entire time I'm thinking about what's the worst thing that can happen and how do I prevent it? Whenever I go into any operation, that's my first thing is how do I prevent the worst thing from happening? Number one. And then number two is how do I get the patient the result that they're looking for? But it's always in that order. And
which makes a good, arguably, which makes a really good surgeon.
Plastic surgeons get sued one out of every 3 or 4 years. I've been in practice almost 20 years. I've never had a lawsuit, knock on wood.
Not wood, but will.
But that's, and some of that I think is that I'm a careful surgeon. I do a lot of surgery, but I also always have patients their best interests at heart, and if I can get them happy without going under the knife, like with what I share in the book, that's the way to go.
And I have a couple questions. I was looking at some of the research and just the data, and correct me if you know a different number, but there are 2 million individuals, I think, that go through liposuction alone a year. Have you looked at any of the data?
Lipo is going to be the most popular cosmetic surgery because often you combine that. Like if you're doing a tummy tuck, most of the time you throw some lipo in. If you're doing, let's say, a brachioplasty, an arm lift, you throw lipo in. So that number is, I think, a little high. My guess is probably more like 500,000, but it could be closer to 1 million, maybe.
Maybe it's 2 million. And again, I have to look, but maybe it's 2 million that get cosmetic procedures.
So there's actually, every year, there's 5 million people undergo Botox every year, even close to 7. I think the last numbers I saw, the number one plastic surgery with like lipo and breast augmentation are kind of always number 1 and 2. You're looking at around 300,000 or 400,000 potentially. I haven't looked at those numbers recently, but that was last I saw.
Well, I was talking to my trainer before our interview, and he said, one of the number one questions that I get as a trainer is, should I do lipo? Is it going to actually help me lose weight? What's going to happen after? And I would love to hear your thoughts on lipo because it's not actually used for weight loss.
No, it shouldn't be. And it's funny because I get patients come in with all different ideas. I had a guy come in to see me a couple years ago, and he was funny. He was probably in his mid-50s, and he comes and sits down. He has a huge pot belly. And I go, well, hey, what, I'm like, oh, John, I'll just say his name, John. What can I do for you? What would you like to talk about? I swear to God, this is literally what I said. He goes, I need to get rid of this blubber. And he starts grabbing his stomach, his tummy. This is all visceral fat, So first of all, liposuction cannot get rid of visceral fat. And so visceral fat is that fat on the inside of our abdomen, around our inner organs and all of that. And that causes the tummy to look rounder like a lot of, some men get. Liposuction, you are limited in general with how much you can liposuction safely.
Isn't it 5 liters?
Exactly. So the FDA recommends limiting liposuction to 5 liters in one setting unless you have blood products available and or you're doing this in a hospital.
Right.
And the reason why is because you lose so much blood that and who wants to undergo liposuction? They get a blood transfusion afterwards. Like, this is just not the right thing. So how much is 5 liters of fat? Well, not all of that 5 liters is true fat.
Right.
You're talking maybe 60 or 70% of it at the most. So you're literally looking at taking off maybe 10 pounds. And now you're talking about a 4-hour huge operation where you're going to lose 10 pounds and you're going to have weeks of recovery. Like, it's not an easy way to lose weight. Ideally, liposuction is best done if you've got stubborn areas of fat that just won't go away. And you and I know, that people inherit fat depositions. Like, if your mom has a double chin, you're likely to get a double chin. If your mom has saddlebags, fat on the outer thighs, like you're likely to inherit it. If your dad has a pot belly, you're likely to inherit that.
Meaning because of the aging, if you do nothing, the natural aging process or just the deposition of body fat?
I think genetically, our bodies are predetermined to hold fat in certain areas. Now, you can lipo some of that fat away, okay, and that will make that go away. But I think those are also areas of fat that are the hardest to get rid of, So once, I have patients of mine who are real thin, but they have a double chin, and their mom has the same thing. No matter how thin they get, that fat just doesn't go away sometimes for them because it's genetically predetermined. Like sometimes that type of fat is the last fat to go.
If it ever goes. Right?
Exactly.
If it ever goes.
And I see that even with people, and I get myself, under eye fat, this puffiness under your eyes, that runs in families too. That is fat inside your eye socket that's protruding. I've seen patients of mine who are in their 30s who have that. Their parents have had it, and then they have kids that come in who are like 12 or 13, and they've got puffy under eyes. We inherit fat deposition from our parents. Yes, with plastic surgery, you can treat that, but it's still going to be in your genes,
But that would be the way. So if you're saying basically if they have, it's spot reduction.
Exactly.
It's only spot reduction. It's not really about... Again, the most you would ever be able to take would be 10 pounds max. And then you have to think about bilaterally, right? If it's both sides.
It's ideally best done in somebody who's at a healthy, reasonable body weight. And they go, you know what, no matter what I do, I've just got extra fat on my arms and my mom has it too, or my dad has it too. Those are really and that's going to be most, I think, beneficial overall because once again, there are those areas of fat that, we people used to believe that, if you've got fat over your arm, you just do a lot of triceps exercise. That'll make that fat go away.
It doesn't go away?
No, as we know, you can't spot reduce fat by working out. And so, there's still that belief I think that people have. I get so many patients who come to see me and they've got, a little bit of extra fat or skin in their tummy after having children, and their husbands, boyfriends tell them, just do more sit-ups. You're not doing enough sit-ups. And it's like, come on, that doesn't work that way.
Get out of here, dude. Get out of here. What happens so you remove these fat cells? Do they ever come back? Do they ever proliferate back?
No, but the fat that's still there, because you can't remove every fat cell, can enlarge. So there is a belief on the minority that if you remove fat from one part of the body, that you will gain it in another area. There was a small study that came out like 12 years ago that appeared to show that, but since then there have been multiple other studies, much larger ones, that have disproven it. I've been doing liposuction for 20 years. I have never had a patient come to see me and they're like, yeah, you took fat out of my thighs and now I've got Popeye arms. That
it doesn't happen.
In 20 years, I've never had that. Now people can gain weight afterwards and fat can come back.
Does it usually redistribute back to those places?
Not necessarily. And the hope and what I try to explain to patients, the ideal is that you give them the shape that they're looking for. You take down those stubborn areas, and then if they do gain weight, they gain weight proportionally with their body. So it's no longer sticking out because now those fat cells are less in number. They may still increase in size, but maybe there's half of what there was before.
And is it very invasive or is it a pretty...
Lipo?
Yeah.
Yeah, it's invasive. So you make an incision, which it's a small scar, which is good. Then we inject a bunch of anesthetic fluid into the area. We call it tumescent, and that has lidocaine for pain and epinephrine to help constrict blood vessels. That was one of the issues with lipo in the past, was that the first type of lipo is you just make an incision, you just start sucking out fat. But they would just bleed like crazy.
Right. Right.
So the epinephrine helps to reduce the bleeding. And then after that, you put literally 1 or 2 stitches in the incision. Then they have to wear tight garments afterwards. Usually the patients drain for several days where they're just draining, seeping fluid. And it's sore. You know, it's kind of, it's not like sharp incision sore, but it's like somebody beat me up type sore. Not that I've ever been beat up before, but that's
we could change that. We're Shane. No, just kidding. Matthew, you up for it? In terms of the increased use of Ozempic, are you seeing that liposuction, do you have an idea if it may become less popular because the non-invasive utilization?
You know, when I started my practice in 2004, we were seeing a lot more like full body lipos. I don't see hardly any of them anymore, honestly. And I don't know if it's just my practice.
Maybe you've already cleaned up everybody in Michigan.
Well, and part of it is that, like, you know, if somebody comes in and they're overweight, like I try to encourage them, hey, you know, work on lifestyle stuff first. It used to be when I was more of a cut first surgeon, I'd bring patients back and we do 4 liters of lipo, like a liter off each thigh, you know, half a liter from the front of the tummy, half a liter from the back, and then we do the arms, stuff like that. I almost never see that anymore. But that's also my practice, is maybe it has evolved. But I do think there's so many people on Ozempic nowadays.
Yeah. Which I think could be really, really great, Ozempic or Mounjaro, especially if you're doing the right things. Your protein recommendation was too low in this book.
Know,
but I won't call you out there. So if you guys get this book, Younger for Life, by my friend, Dr. Tony, the protein recommendation is way too low. So you're going to skip over that.
It's interesting because when I wrote that, which I wrote it about, you know, I mean, it's coming out now, but it's been written over the past couple of years. You know, that's interesting because it's gone, and I myself too, my thoughts have evolved. I was wondering if you're going to bring this up,
yes.
You know, because there are longevity docs, like, you know, I really respect Dr. David Sinclair, you know, and how you look at longevity and how protein, a lot of them in some of their studies that they're looking at, how that impacts longevity in one way, but then when you look at it in a different way, and what are real world situations. And one of the things I put in the book is, you know, as you get older, there's a study that found that over the age of 50, if you break your hip, you have a 30% mortality rate over like 12 or 24 months. Like, it's crazy. And it's over the age of 50. Like, I'm 51. Like, what? And so one of the things that I think, once again, when you talk to longevity and quote unquote anti-aging scientists, they may tell you, okay, less protein may increase your longevity genes and have you live longer. But then the question in real life is, if you aren't having enough protein, how are you going to actually function with sarcopenia and all those great things that you have brought up? So my thinking, even since writing the book, I'm kind of torn, because I think the science goes different ways depending on how you look at it. I think from a real world perspective, and especially when I look at my patients who are mostly women and most of my followers, I'm kind of going in a...
I'll give you a pass this time. And also, you know, I have to say, surgical recovery requires dietary protein. And also, when you're not able to do training, a lot of post-operative patients, you're not going to allow them to do any kind of load or weight-bearing activity. They have to maintain that muscle.
You're losing muscle. And so all my patients, you know, one of the things that I did, and one of the first things, honestly, that I did after I had that tragedy in my practice, was I started thinking about how am I practicing as an actual surgeon. And it used to be, and this is how I was taught, is patients would come in, they go, hey, I'm on all these supplements, what do? I say, well, just go off of them, because I didn't know about supplements. I wasn't taught about it. And so I started actually looking into the literature in both, and I was combining the surgical literature, and a lot of that was in like ICU and wound care, with the writings of alternative health experts. And I created my own pre and post-surgical supplement protocol.
We got to hear it.
And so basically it was combining the two, and a big part of it was amino acids, was proteins. And so it was glutamine, it was arginine. And so all my patients, I started putting them on this pre and post-op surgical protocol. Now, the big, you know, so it was arginine.
It's evolved. Is it evolved now?
It has, you know, the interesting thing, so it was arginine, glutamine, then we'd have anti-inflammatories like bromelain and what's it called?
Serapeptidase?
Well, actually, no, it's Synec, which is, I'm blanking on the name all of a sudden. That's the brand name that we use for it. Anyways, I'll throw that aside. We put them on omega-3s afterwards. It was a probiotics. And then what I found, so I started testing people on this, and I found that basically my complication rate dropped. People seemed to heal faster. And honestly, what I was getting, a lot of people, and then we put them on a multivitamin that also had amino acids with it as well. But what we found is that people would have a lower complication rate afterwards. And I had so many people that would come to see me afterwards and I say, hey, you're done with the supplement. So it was literally, they start 2 weeks before surgery and they would complete about 6 weeks after surgery. And then people would say, I feel so much better after taking these supplements. Can I continue taking them? Well, one of the reasons why with protein is, just like you said, is once you undergo a general anesthesia and so many patients are not moving afterwards, there's a significant breakdown of skeletal muscle.
Yes.
And if you are not eating enough protein, then you really have to make up for that. And because people aren't going to eat protein because sometimes they're sick to their stomach, they don't feel like eating much. And protein, as you've taught, it's not, the easiest thing to eat. Like it's hard to overeat protein.
Very difficult.
Much easier for them to sit down and to eat a bunch of carbs and stuff. And so for us, we put them on these supplements. And I never actually went public with it because, so I had some of our friends say, oh, you should, create this. And it's the healing diet and the healing supplements and stuff. Because my worry was that a patient would go on this and then they would get a complication like a hematoma or something, which can happen to anybody.
Right.
And their surgeon would blame it on me.
Yeah.
And now the patient would be upset with me, like, oh, my surgeon said that you're the reason why I got a hematoma from this gallbladder surgery or something.
Right.
And it's
hard pass.
Yeah, no thanks. I don't want to take that.
But the amino acid, and I will mention, you guys, if you're interested in the longevity conversation, everybody, if they're listening to this podcast, they definitely know my stance. But if they are your follower, they might not. So we'll refer them back to Forever Strong. You guys can read all about it. The amino acids pre and post is very interesting, and especially the full spectrum of essential amino acids is amazing. If you had to pick one supplement or one strategy, do you think that there is something that really, really helps with recovery? I mean, I love the idea of glutamine. That's usually for gut health.
Yeah.
Is there one?
I don't know that there's one specific thing. I mean, what we've done now is we are converting. There's actually, so has been very interesting is that I created this protocol, and for probably about 7 or 8 years, we had all my patients on it, and I didn't publicize it or anything. Now there are actually companies that are coming out. There's one called HealFast. It's a friend of mine who owns it. And they're actually coming out with these pre and post-op supplements. They're all kind of grouped together, and they're getting venture capitalists and stuff like that. They're starting to invest in them. And they're the same things that I had created like years ago, but it's fine.
Yeah.
It's fine.
That's totally fine. Thank you to Bite for sponsoring this episode of the show. I want to share with you something that I love. I love clean, fresh breath. You should love it too. And that is why Bite is amazing. Bite is exactly what it sounds like. Tiny little toothpaste, almost like mints. You pop it in your mouth, you chew it up, you take your toothbrush, get your toothbrush wet, brush it, and it doesn't have any of the fillers in it, no harsh chemicals, nothing artificial, and no preservatives. There's a lot of discussion about the mouth microbiome, and that is one reason why we want to limit a lot of the chemical exposures that we are using, especially in our toothpaste. Bite makes a great one. It is also environmentally friendly. It doesn't use those plastic tubes. They come in beautiful glass, tiny bottles. And I'm just going to throw this out there. They make other products like deodorant, mouthwash, and of course, toothpaste. And you name it, they make it. Please go to trybite.com/Dr. Lyon and you will get 20% off your first order.
So I don't think there's one thing. I think there's things that, like for me, once again, omega-3s I think are really good, but you got to wait a couple weeks after surgery. Then definitely start that. Yeah, because of the risk of bleeding. I think that protein is huge, obviously. If I had to pick one, and not because you're sitting here in front of me, but I do think protein is one of the biggest things. The other thing would be the probiotics, because so many patients are on antibiotics afterwards. And I've had a couple of patients prior to putting them on probiotics regularly now, years ago, who had C. diff infections after being on antibiotics after
interesting.
surgery.
So for the listener, C. diff is pretty impactful. Gut infection can cause chronic diarrhea.
Yeah, it's not fun. And so what happens then is if you're on antibiotics, basically the antibiotics will then, completely disrupt your microbiome, killing off a lot of the healthy bacteria. And this potentially can allow Clostridium difficile to take hold. That can cause basically a gut infection. And that is, you can get diarrhea from it. You can get horrible stomach pain and abdominal discomfort. And what you do, you treat that with another antibiotic.
Right. Right. Okay. This is actually, so part of my team made me do a quick fire round.
Okay.
And I definitely
I'm
want
up
to know
for
this.
it. Let's
Okay.
do it.
So all you can say is yes or no.
Oh, that's gonna be
Or
hard,
okay,
but
fine. Then you can add.
I'll do. I like 2 sentences. How about
Okay,
that?
you get 2 sentences.
All right.
Julia, Mitchell, this one's for you. Is it called guasha?
Guasha. Guasha.
Is it a
Go
yes
ahead,
or
yeah.
no?
Oh, I'm sorry. Yes.
Okay, for what? So, and what is it? It's these,
So gua sha
yeah.
is it's like a little stone that has a specific curvature to it that kind of, it's for some reason, and it comes from, I think it's Ayurveda. But it has a special shape that you can basically rub it along the sides of your face. And it's good for pushing out like lymphatic fluid, essentially. Now I know.
Wait, why would someone even use it? Why
You said I have to only say yes or no.
Okay, well, I want to know why would someone sent it to me. It's beautiful. I'll put it on my, like here on my neck, my shoulders. I know that I'm not using it for anything specifically, but why would somebody use it?
So the belief is that it can help give you a snatched face or snatched neck. That's the belief.
I don't even know what that is, but
snatching is when like everything is like perfect, like straight lines, like snatch. So a snatched neckline is like a straight line neck, like what you have, and what I used to have maybe 10 years ago.
I know a good surgeon.
Snatched
for that.
body technically is going to be like model type of.
Okay. So gua sha is a yeah. That looked like a questionable.
It's a yes, but it's limit. There's a belief that it does a lot more than it does. It's not going to rearrange where your fat is on your face or anything like that. It really is a temporary benefit to reduce kind of initial swelling. So if you go on a bender one night and then the next morning you're all puffy and you're like, oh, I got to go see somebody, then using a gua sha can help to kind of push some of that fluid out.
All right, threading.
That's a big no.
Oh, so I did that once. It was so painful. It was a terrible idea.
Yeah. No, that's a big no.
Okay, tell us what it is.
Okay, back in 2000.
And I can't believe I tried it.
I mean, you know what?
I should have asked you.
Yeah, that's okay. So back in 2004, that's when threading first came out. And it's the idea of you get a barbed suture. Sutures are basically smooth, like they're like fishing wire. But if you take a knife and you cut little tiny barbs into it and you run that under the surface of your skin, it can basically, the connective tissue fibers can kind of stick to it. And if you pull it on your skin, it can make it look like your skin's being lifted. So back in 2004, there were all these doctors saying, this is a great non-invasive facelift. It's amazing. And they pull the skin up and they look at how amazing this is. And what would happen is because you're not truly changing the architecture of your face, that suture is not going to truly move something for a long time.
So just to give people a visual, Matthew, are you listening to this? Okay, guys, Matthew, as you know, is my producer. They put, I don't know, but they put like right under your skin a suture, a bar, like this suture where they put it in and they pull part of your skin and then hook it somewhere and then
Yeah, well, because there are barbs in it, basically the idea is it stays in place. And so instead of having just like one stitch that you try to pull and like suture it somewhere, like the whole thing, the idea is it sticks. But the problem is that the tissue will cheese wire through that within the span of a couple of months. And the initial sutures were permanent sutures. And so people get like a 3 or 6 month result. And then years later would come to see people like me and like, what is this sticking out of my face?
Oh my God.
And it was the end of their suture that's still there.
I don't think that I couldn't have gone to someone that JV,
So then that fell off. People are like, oh, this doesn't work. And so for many years, it just disappeared. And some of the companies went out of business. They stopped making them. And then just a few years ago, a new crop of plastic surgeons comes around and dermatologists are like, this is a great new way of lift the face non-invasively. Now, the sutures now are absorbable, which is good. So they're not coming out years later, but it still only lasts about 3 to 6 months. And I don't think it's harmful specifically, but doctors need to be honest and say, hey, look, you're going to spend $4,000 or $6,000 and you're going to get a 3 or 6 month result. And if that's what they want to do, then that's fine. But yeah, it's a big no.
So it's a big no-no. And I don't even know why I did it.
I mean, people, you get sold. There are doctors out there where their consultation is, let me sell you something. And it's terrible. But
it's terrible. Okay. Anti-aging facial exercises.
Okay. So there is science behind some of that.
Stop.
Okay, so the idea is kind of like face yoga, is that you make all these weird expressions, and they say that you are strengthening the muscles of your face that have gotten droopy and weak. Now, the truth is that it's the opposite of Botox. Okay, so what does Botox do? Botox prevents transmission of nerve impulses to muscles, causes muscles to basically weaken or to become paralyzed, and those wrinkles smooth out. The opposite of that is making tons of facial expressions, and the more expressions that you do, the more those wrinkles created by those expressions are going to get inset in. That's why like Jim Carrey, and I love Jim Carrey, he's not going to age well because of all those facial expressions that he makes. So where's the truth behind face yoga and doing this? Basically, in the end, what it comes down to is the more of these expressions you make, the more wrinkles you get. But if you do a lot of that, those muscles will get a little bit bigger. And there are some scientific studies that have shown an increase in volume in the face by doing those exercises.
And that would make sense because it's hypertrophy.
Exactly.
It makes sense. This is one for me. Sleeping on your stomach, sleeping on your face, mushing with the pillow. Yeah. Is there something, number one, does that cause wrinkles? And number two, do people need to use silk?
It does cause wrinkles. What? And if you go with silk or satin, that's going to be a bit less. And there are even special pillows, and I've tested some of them. They send to me that I just feel they're weird, where they cradle your face in a certain way so that you can sleep on your side and not scrunch up your face. But sleep wrinkles are real.
No. What do you do for that?
I mean, just try to prevent them.
Is it like sleep on your back?
I mean, you can, or like I said, satin or silk. I think that helps because you're not getting quite that friction. And then there are these special
ruining my day.
There are these special pillows that these weird shapes and stuff, and I've used them, and I just weird. Like I don't know.
I'll do it if it means I'm not going to be mushed face.
Well, there are some people who sell pillows that are between the breasts too.
I definitely need those. Well, have you ever tried Cozy Earth sheets? They're like so soft. They're bamboo. They're not. They're like viscous. They're really. I'm gonna actually ask them. I'll see if it's anti-wrinkle. Now we'll get into some others because I'm curious. Cupping for the face. Have you seen that? Cupping for the face?
I have. I think it depends on how aggressive you are. Like there are people who do real mild cupping where it's like a little suction cup and you run it onto the skin. Really with that, you may be creating some very mild exfoliation, maybe increasing a little circulation to the face, but it probably doesn't do a whole lot. I wouldn't be aggressive with cupping like they do on the backs and stuff because you don't want to get the bruising and all of that. That could be potentially harmful.
A lot of discussion about lasers. What's happening there?
So lasers are there's so many kinds of lasers out there. And I think that's what you want to consider is that there are non-invasive lasers that we call non-ablative that are very mild.
What would that be?
So there are ones like say there are ND-YAG lasers that basically are used to help increase the temperature of the skin to create some collagen synthesis. Those are very mild.
Called something like the Ulta? Is it no?
There's a lot of different names. I think Moxie would be considered one of those. It's a non-ablative fractional type laser. And then there are the ablative fractional lasers where, so essentially the old style, let me start from the beginning. The old style lasers basically burned all the skin off your face.
And would that be a Fraxel?
No. So that's not. So the old-fashioned lasers are like the CO2 laser.
CO2.
That's the most popular one back in the day. The erbium was another one where literally what lasers do is lasers target a color and they heat up that color. The color or wavelength. And the wavelength or the color that they initially used was the color of water. Believe it or not, water has a wavelength of color to it, even though we can't really see it. So anything that had water in it would basically burn. And so when you hit the skin with that, our body is composed, like 60, 70% of water. So basically just burn your skin from the top down. And the idea is you get an exfoliation of the outer layer of skin and you get heat in the deeper layer of skin to cause that skin to tighten up. Okay, so all the laser treatments and whether it's laser, ultrasound, radio frequency, they're all meant to create damage to the deeper skin, usually via heat. And when you damage the collagen to a certain extent, that collagen will heal in a tighter fashion. It's almost like hormesis in a way.
And does it work? Do these lasers work?
It does work. And so the original lasers basically heat it by burning everything from the surface down. The newer lasers now are fractional. So instead of burning all of your skin, they burn a fraction of the skin.
Is that why it's called fractional?
Yep. Or pixelated. Like it's literally like tiny little dots that are like columns of burning into the skin. That heals faster with lower risk of complications because if you do a traditional ablative laser, some people, it destroys sometimes the melanin of your skin and you can look almost ghost-like afterwards and stuff. And then there are non-ablative lasers that create heat, but without creating these columns of damage. Those are not going to get you quite as much of a result, but they can still help.
And an example, would that be, what are they, like broad spectrum? They're the pulsatile?
So there's BBL and IPL is a separate category that's similar to lasers. Those are really good for spots. Okay, so if you're looking for just truly tightening the skin, just overall rejuvenating the skin, then you can get these laser treatments, which I think are very powerful. They're very good, but they come with significant downtime and they're expensive. It goes for me to buy a laser, it starts at around $200,000. IPL also uses light energy, but it's a little bit different, and these devices are less expensive. The most common use of IPL is going to be for targeting dark spots. So what they'll do then is they'll target brown. And so if you've got brown pigment on your skin, it can target that, zap that pigment, and then that pigment within a week or so gets darker and actually will slough off. And that's what IPL treatments are, or BBL is the same thing.
Is it fair to say that the more aggressive the laser, the more result you're going to get?
Yes. Yeah, but also the higher risk of complications. Lasers are not the best bang for your buck too, because they are so expensive. If you're looking at good bang for your buck, IPL is good. Once again, an IPL device may cost me $100,000 to buy, a laser at maybe $200,000. So the cost of the treatment is going to be passed off onto the patient. Microneedling is going to be on
my list.
Okay, so that's going to be on the more affordable side.
Is it a yes or no?
That's a yes. And that I would, because maybe I only pay $6,000 or $7,000 to buy a microneedling handpiece versus $100,000 for IPL, the cost of treatment is going to be much less.
But the outcome, from what I understand, so there's a few outcomes that people are looking for. And you guys are listening and thinking, okay, well, you usually talk about health and wellness, but this is part of it. I am telling you, people will do so much to maintain the health and wellness of their body and to look good.
Well, I think it's so important because there is so much that's available that people don't know about to turn back the clock.
I don't even
get
know.
them how, and you're, obviously an educated trained
like
physician.
I'm somewhat educated because there's so much noise out there and it becomes very difficult to understand what is going to work, what is a short-term fix. So for example, if you do an ablative laser, the outcome that you're looking for, from what I'm hearing, that each laser or each treatment has a particular outcome, whether it's a IPL for less brown spots, whether it's an ablative treatment for...
That's going to be like acne scarring. Like if you've got severe like cystic acne scarring from it as a teenager, then maybe doing one of those types of lasers, which is going to be the most powerful, that might be worth it. But if you've just got like spots and somebody says, hey, do an ablative laser, like that's like you're at a sword fight. You're at a sword fight and you're bringing like a cannon, that doesn't make sense.
So the ablative laser would be things for wrinkles and skin texture.
For like severe aging issues or texture issues, like if somebody comes in and they've got just horrible aged skin, they haven't taken care of themselves for decades, that's something, that may be beneficial for them. But in general, I would save it mostly for people who have bad old cystic acne, because that's really, really hard to treat. And the less invasive options don't do a whole lot for that.
Because I'm curious, if someone, say they never want to go through with surgery, there are inevitable phases of aging, right? Or do we know what someone looks like who's never been in the sun and done everything right?
You just have to look at your bottom, at your butt, because that's not in the sun usually, unless you're a nudist. God. So you compare the skin of your butt to the skin of your face or your neck or your hands, and that's, in general, that's what your skin should look like. Yeah. Yeah. So I think when you look at, I think the exciting thing right now is that there's so much that people don't know about. When I look at non-invasive and kind of like where you want to start with, what I really recommend is people start at home with something like a red light therapy. I think red light therapy is great. And
is there one is there a certain wavelength that you like?
So red light usually is going to be in, if I remember right, the 600 nanometer wavelength, and you can go anywhere from 600 to like 630. I don't think that that's going to be that important. It's just going to be the device that you're using and whether you're going to stay consistent with it. And so for red light, there are handheld devices that I'm not a big fan of. They're not that expensive, but it's onerous. Like to be moving around your face every, a couple times a week, it's a lot. The masks I think work pretty well. I use those.
You do?
Yeah, I've got one. It's kind of freaky looking.
Your skin is really good.
But I work on it too, and I'm Asian, so that helps.
Wait, so the mask, my girlfriend Raquel Frisella, she does a lot of cosmetic stuff. She sent me one of the red light masks for Christmas, and you think that they work?
So there are studies that actually have split face studies where you have a sham laser on one side of the face and then the red light therapy on the other. And some of the studies, even in as little as 4 weeks of using it a couple of times a week, have shown an improvement in the collagen and the elastin in the skin.
And the outcome would be less wrinkles, tighter skin?
Yes. Yeah, basically improvement in collagen, elastin, tighter skin, smoother skin, that type of thing.
When someone stops, does the skin reverse, or when you make improvement in the skin remains improved? Thank you to InsideTracker for sponsoring this episode of the show. InsideTracker makes looking at your individual blood biomarkers very easy. Things like ApoB, which is a risk factor for cardiovascular disease. Also things like insulin and thyroid function. These are markers that should be checked regularly. And most important, there should be a low barrier to entry, meaning it's really important to do and it should be easy. That is why I love InsideTracker, because it provides you with a ton of data, very little time it takes to get it done. Not only that, but once you have a good understanding of what's going on in your body, you can pivot and make corrections, because as a living, breathing being, it is a very dynamic process to figure out what works and what doesn't. InsideTracker also offers tools for professionals. InsideTracker Pro is a no-cost platform that allows your clients to share their InsideTracker analysis with you so that you can tailor their health protocols and training based on their results and InsideTracker's recommendations. Please go to InsideTracker.com/Dr. Lyon for 20% off the entire store. That's InsideTracker.com/Dr. Lyon for 20% off the entire InsideTracker store.
That's a good question. I don't think it's not like you're going to like revert right back to where you were before, but the time keeps on ticking forward, and it's like that with any of these cosmetic treatments, is that unless you're having an operation where you're cutting out skin, the time is going to tick forward at the same rate as it did before, hopefully slower if you're, making these lifestyle alterations and stuff like that.
Very diligent about it. What about topical type treatments? So there's retinol. What do you see for if an individual really wants to maintain the health of their skin and they don't want to get a facelift?
Yeah. So the first thing is I recommend this, and something I have in my book is called the 2 minutes, 5 years younger skincare routine.
2 minutes,
5
years, I'll take it.
So very simple. And we tested on people where we put people who had average skin. So this wouldn't be with you. You're not going to look 5 years younger after 2 months like them. But we tested on people. It took them 2 minutes a day. And after 2 months, we actually took their before and after photos. We put them on Instagram and asked people, how much younger do you think they look? And they looked approximately 5 years younger. So every morning, you cleanse your skin with the cleanser appropriate for your skin type. If you've got oily skin, you want to use more of a foaming cleanser. If you've got dry or sensitive skin, then you want to use more of a milky or hydrating cleanser. After that, you want to use an antioxidant serum. Antioxidants fight free radicals and oxidation, which is one of the main causes of aging of our skin. Bonus, if you add vitamin C and vitamin E together, that will give you actually more of a synergistic effect. That's one reason why it's actually our most popular skincare product is our CE antioxidant serum.
But you're talking about topical as opposed to external.
This is all topical.
Okay.
Yeah, this is topical. And so you apply vitamin C serum. If you add vitamin E to it, that's an even bigger bonus. Okay, they're synergistic together. And then I do recommend a sunscreen afterwards, especially if you're going to be out in the sun. We can talk all about that if you want.
I do. I want to talk about that because my mom was visiting and she always wears a hat. And I go, Mom, just put on sunscreen before you go out. And she's like, no, it only lasts 45 minutes.
No, you should get a couple hours out of that.
So I do. We have to come back to this whole sunscreen. What does the SPF mean?
Okay, we'll talk about that. Okay, so you apply a sunscreen, usually at least SPF 30, especially if you're going to be out. My dermatology friends will say, if you're sitting in a basement all day, still put your sunscreen on. I don't do that, but okay, you do you. And then that's all you have to do in the morning, okay? Cleanse, antioxidant serum, sunscreen. In the evening, got to cleanse your skin. Super important. If you only wash your skin once a day, you have to do it in the evening. You got to get rid of the day's worth of dirt and grime and pollution and dust and makeup and all that stuff. And then you want to ideally apply some type of an anti-aging cream. The first one that I would recommend would be a retinol. You mentioned retinol a few minutes ago. Really, if you were to ask plastic surgeons and dermatologists, what is the number one anti-aging skincare ingredient, they would say retinol. Now, the studies, though, have been done on tretinoin or Retin-A, which is the prescription strength version. Prescription strength Retin-A has been shown to improve fine lines and wrinkles, to exfoliate the skin, to thicken the dermis or the deeper layer of the skin, to improve age spots, and to even reverse early pre-skin cancers. So it's a lot that does. Now, retinol is the over-the-counter version of tretinoin. And retinol, reason why it's over-the-counter is that when you apply it, retinol is non-active. But then after you apply it to the skin, it undergoes two chemical changes to become tretinoin, to become
I had no idea.
Retin-A. Yep. So it goes from retinol to retinal and then to tretinoin. And so it basically becomes the same thing. It just isn't applied. When it's applied, it's not active. That's how it gets, that's why it's not.
Does everyone's skin have that change? equally?
In general, yeah.
Okay.
I mean, it should work. I've not ever heard that, certain people it just doesn't work for. But the problem with retinol, and why it's not for everybody, is that it can create some acute irritation. So one of the big benefits of these retinoids is that they reduce chronic inflammation being a huge part of aging of our skin. And so the idea, though, to reduce that chronic inflammation, in some people, you start off with some acute inflammation first. And so some people, they apply retinol or Retin-A, skin gets red and dry and flaky for a while. You kind of undergo what we call purging. And then within 6 to 8 weeks, that goes away, and most people can tolerate it. But if you can't, if you've got real sensitive skin, then you may want to go with bakuchiol. Bakuchiol is a similar anti-aging ingredient. It's plant-based from a plant called the bobchi plant that's actually been used in Ayurveda and ancient Chinese medicine for hundreds of years.
Is this a new thing, or is this
relative? I mean, it's been around for a long time, but in skincare products, it's relatively new. So bakuchiol has been shown in a head-to-head study against retinol to have very similar anti-aging benefits, very similar, but less skin irritation. And so for those people who are like, geez, I have really sensitive skin and I don't know if I want to use a retinol, then say, you know what, go with the bakuchiol because you're going to most likely get a fairly similar result.
Okay. I mean, that's pretty easy. Is there more to the 2 minutes, 5 years?
And that's it for night. If you want to apply a moisturizer on top of it, you can, especially, if you live like in New York City, it's February, everything is so dry, then by all means throw a moisturizer on, but you don't have to. If you're in Louisiana in August, you don't want to apply moisturizer, and by all means don't. And then just once or twice a week, you want to exfoliate your sskin.
I was going to ask you about that. And that would be like a koji pad, something like that?
Yeah, so you can use basically like a gentle scrub. You can use like a light acid type peel pad, that type of thing. That's fine.
And then that glass skin trend. Have you seen the glass skin trend? Is that a real...
I think it's more of like a goal. It's like a goal. And there are treatments. We have one treatment in my office that we call the glass skin treatment, where we basically microneedle the skin with a combination of just a tiny bit of Botox, a tiny bit of filler, growth factors, and sometimes we'll throw in PRP into it. And that's kind of a glass skin thing. But glass skin is really more of like a description of skin that is just like luminous. It's moisturized, it's smooth. It's the skin that we all would love to have.
And it sounds like one could accomplish that by
doing all of these things. And the first step, for people who are listening, they're like, geez, I just use soap and water, or I just use these cleansers or whatever, is to start with that 2 minutes, 5 years younger skincare routine. Like that's the basics. And if you want to apply more onto it, then by all means do that. You can add a toner to it if you want, but you don't have to. Like you stick with these basics, then you're still ahead of the vast majority of people.
Yeah, I can appreciate that. What about, there's a lot of talk about these topical peptides. Have you looked at the copper peptides, et cetera?
So peptides are another group. When I say you apply an anti-aging cream at night, peptides are another group that you can use. Peptides, they are proteins that send cellular signals to our skin cells to create more collagen. The other group of anti-aging ingredients that I haven't mentioned are growth factors, and they do kind of the same thing. So the idea behind both of those is that they send these cellular signals to create more collagen. Exosomes now are a kind of more...
Yes. Can you explain that? What is happening in that domain?
So these are also the same idea, is that these basically are these types of clusters of proteins that create, that cause your body to create these cellular signals to create more collagen. The exosomes, the idea behind exosomes, and I think why people are so excited about them, although there's still a question with legality in my understanding, is that they can do a lot more than just peptides. So the idea behind peptides is just collagen stimulation, whereas exosomes may also be able to reduce inflammation and things like that simple peptides cannot do. The benefit of peptides and like copper and stuff like that is that they're not that expensive and they're very easy to tolerate. So if you, let's say, can't tolerate retinol and you're on a really strict budget, a lot of the kind of like budget drugstore anti-aging creams contain peptides. Does
it matter how you layer the skincare? So for example, you put vitamin C, vitamin E, will that be deactivated by a sunscreen or a cream that you put over that?
Not necessarily, but ideally you want to go two things. You want to go from light to heavy. Okay, so you want to start with like the lighter serums, the essences, and then go towards like the moisturizers afterwards, and then the sunscreen last typically. And then the other thing you want to go is active to inactive in general, because let's say you put a real occlusive moisturizer on, and then you apply a retinol on top of that. Like that occlusive moisturizer may actually keep that retinol from doing what you want it to do to
So
the skin.
active to inactive. So
Active
the
to
retinol would be
inactive,
first.
light to heavy in general. And sometimes you can't, it's not perfect, but those are the two things you want to look at.
Now, another question that I get asked a lot is this crepey body. Do people ask you about that too?
It's hard. Yeah.
The body treatments.
So there isn't a lot. There are some companies that have, and this is one thing that we're looking to develop for Youn Beauty, is a body like retinol cream, because really what happens is that 70 to 80% of our skin is composed of collagen. And that's the part of our skin that makes our skin nice and tight and strong and smooth and youthful. But we lose about 1% of the thickness of collagen every year. And women after menopause, you're looking at upwards of 2% a year. And that's why you have women who are in their 70s and 80s and their skin sometimes is so like tissue paper thin that it even tears. And so one of the big things we want to do is we want to increase the collagen in our skin as we get older. What was your question again? I'm answering it.
Crepey
okay.
skin.
All of a sudden I forgot.
Well, because I was thinking, I have seen that so often in the hospital. If they were on hormone replacement treatment, would that... I'll look at some studies to see if it increases.
That may help. I'm not sure.
Yeah.
But that's one of the things. I do think that my understanding is that once women go through menopause, that, the skin gets even thinner, and and that collagen degradation increases. And so the idea behind crepey skin is that you've got basically thinning of that collagen. And so what can you do? Well, you can eat more protein. I'm a big fan of collagen supplements. We talked about that prior to us recording. And then the other thing would be applying a good cream like a retinol that does help to increase the collagen of the skin. So I would look at those kind of three things that I could see just as very simple. Increase protein, obviously prevent the sarcopenia, because collagen is a protein. It's a large protein.
Yes, I know. I love collagen. I don't love it for muscle, but I do love it for skin.
Yeah. Well, So, and collagen that you use for the skin is not necessarily the same that's muscle anyway, because muscle is type 2 versus type 1. So,
so I know that you have a collagen supplement. When you made that, did you think about
or type 3.
The types?
Muscle is type 3 collagen. 2 is joints. Type 3 is muscle. I'm sorry. Okay.
So do you, because the amino acids are very difficult to get into the bloodstream, but I do know that the collagen, again, I actually looked up the study that you had in your book, which was really well done, that you can increase the blood level of proline, glycine, some of these other things, which I was actually very surprised about.
Yeah, it was interesting because, there's so many people, I've talked about collagen on social media, and so many people say, oh, I asked my family doctor about that. And they go, oh, it doesn't work. Don't bother with it. Studies don't show that it helps. And 10 years ago, even maybe 7 years ago, if you had said that, then that may be not an inaccurate statement that there isn't the science there yet, but there's so much science now that is so pro collagen. There's actually a weight loss surgeon. He's a bariatric surgeon on TikTok that I follow. And he's an older gentleman with a bit kind of a bushy beard, and he speaks with a lot of authority in his voice. And he made a video a couple years ago about collagen supplements and said, basically, if you are taking collagen supplements, you're wasting your money. Just go to the store and buy some gelatin. It's the same thing. And I was like, oh. Interestingly, a few months ago, he had a follow-up video, and he's watching his first video. He swipes it away and he says, I was wrong. And he said, there are beliefs that we have that we go by, blah, blah, blah. And he was like, I looked at the science and collagen supplements work. So the key with collagen supplements and what you're getting at really is that collagen is a huge protein.
Yes.
And how do you know that you actually absorb it? Does it get broken down? Does it go through? How do you even know you absorb it? And so what I recommend are hydrolyzed collagen peptides. And that's what all the studies look at. And so hydrolyzing collagen essentially is you take that large protein, and you break it down into individual amino acids and peptides. And those are going to be much more bioavailable. Your gut can absorb that. And just like you mentioned, there are studies that do show that they put people on these collagen supplements, they take blood levels later, and they see those amino acids are increased in the blood. But also there have been biopsies of skin showing the same thing. An increase in pro-collagen of the skin afterwards. And there are studies that show an improvement in fine lines and wrinkles and hydration and elasticity. So really, if you have people now that say that collagen supplements don't work or that the science doesn't prove it, they just haven't actually looked at the reasons.
I am definitely on board for all of the things that you mentioned. I also think that the dosing that people are using is quite low. I use 20 grams, but this is all anecdotal.
Yeah.
I think that at least 40 is probably going to be a better target, if not more.
Interesting.
But the tricky part is, it's not a complete protein. What are the ratios?
It's not a substitute for, it's not a protein macro.
Right.
That, you can't count that. Yeah.
Right.
Yeah. And I think that's something a lot of people don't realize is that, yes, you should not count that as part of your daily protein intake.
Have you looked within your own patients, the dosing of collagen? Do you see that, do they do better with 2-3 scoops?
We haven't necessarily, because we put people on the same amount just because that's what's always been recommended. And because I'm not conducting a true study, it's not something that we have really tried messing with.
What about hyaluronic acid?
So hyaluronic acid is a naturally occurring moisturizer of our skin. It's also what we base most of our injectable fillers from. And it's something that's often used in skincare as a humectant. Basically, it helps to absorb water to act essentially as a moisturizer. So using a hyaluronic acid like a serum, I think is great. And you'll feel it when you put it on your skin. It's the good thing with hyaluronic acid is your skin's going to feel moisturized, but not greasy. Filler is a whole other story, and we can get into that if you want, but that really, the thing for fillers now is we use hyaluronic acid because it is so adaptable and we can create really thin fillers for like thin skin, like say under the eyes, or you can cross-link it and make it much thicker. That's going to have more solidity to it that we can put, let's say, in the cheekbones and like in the chin and stuff like that.
Do you have any concern about it seems like there's just an increased use of all of these things, whether it's filler or Botox. Do you have any concerns from a health perspective? And also just with our youth, it seems that it's getting younger and younger, the usage.
Yeah, and I'm not a fan of that. I mean, in my office, number one, anybody who's under 18, we just don't see them, period. And even those people who are 18 to their mid-20s, we're careful with them because, unfortunately, social media and a lot of the celebrities on social media have really pushed all of these procedures. For me, Botox, the worst thing with Botox really is that eventually you may, like if you do it when you're younger, I don't think it's necessary. It's kind of a waste of money, like preventative Botox.
Right.
But the worst thing that can really happen is you can get like a droopy eyelid maybe. And then later on when you may need the Botox, you may be developing antibodies to it because you've used it for so long and maybe it won't work, So that's one thing. Filler is a whole other thing because that can be dangerous. If you improperly inject filler, people have gone blind from it. People have lost parts of their nose and their lip and stuff like that. So that's a whole other thing because it's definitely a riskier procedure. But there are operations that are being done in young people that I have more of a concern with because now you're talking about irreversible operations. And I've gone public with some of them because I feel like they just aren't worth it for young kids. And so now you've got people who are doing this upper lip lift operation where they remove skin from the base of the nose to lift the upper lip. And they're doing this in people who are in their 20s and 30s. Well, I just talked about how collagen reduces as we get older, and what we see is that in people who are in their 70s and 80s, they get like a skin cancer on their nose, and we can take skin from their forehead, move it down the nose, reconstruct everything. And 6 months later, you can't even see their scars because the collagen in their skin is not so robust. The scars aren't going to get thick. But you do that in somebody who's 20 or 30, and that scar is going to look terrible.
Thank you to Phorm for sponsoring this episode of the show. If you do not take a multivitamin, you should. And Phorm makes a great multi. It's not easy to get all the nutrients that you need in your soil and from your food, which is why you should have kind of like a insurance backup plan. And one way to do that is to be taking a great multivitamin. Phorm's Micro Factor Complete Daily Nutrient Pack, easy to travel with, has a pack for antioxidants, CoQ10, which is really good for skeletal muscle health, essential fatty acids, fruits and vegetables, and of course, the multivitamin, and last but not least, a probiotic. You can get yours at firstform.com/Dr. Lyon. That's firstform.com/Dr. Lyon.
So now you have doctors who are creating scars at the base of the noses in people who are in their 20s or 30s to try to lift their lip a bit for a cosmetic benefit. You have doctors taking fat out of the insides of the cheeks and doing all these other types of operations, even doing brow lifts with scars in their brows and stuff. And I feel like it's just getting really, really excessive. And it's hard because I come forward with some of that stuff and I get plastic surgeons who get upset with me. Breast implant illness, that's another thing. It's like you come out with what you believe is the truth. And unfortunately, that gets people who use that as their moneymaker, and they're not.
What do you
happy.
think about, what are your thoughts on breast implant illness?
So it's a real thing. It's something that dogma in plastic surgery for decades has been that breast implants are safe. But the studies really have not closely looked at those autoimmune symptoms and systemic issues with them. And so now there are more and more studies coming out showing really we don't have any study that creates a direct correlation between implants and all of these illnesses. But what we do have are studies that show that if you have a patient who has implants, who develops symptoms of brain fog, fatigue, hair loss, rashes, stuff like that, anywhere from about 55 to 85% of them will improve if the implants are removed. We know that for sure. But what we don't know is what percentage of women who have implants will develop BII. Are there other factors involved? Are there genetic factors? Are there lifestyle factors? There's so much to it that we just don't know. And unfortunately, I think we're also in a time where there are people who are using patients who are sick like that as profit centers.
It's terrible.
There are doctors who are recommending operations that are not
Terrible.
necessary for them, doing these huge operations to remove what we call capsules and stuff that may not necessarily be necessary. And they're charging huge amounts of money and saying that they're specialists at it. And I have even colleagues of mine who will sell huge detoxes and things, saying, oh, you're only going to get better if you do this detox, and there's no science to show that that's true. And now they're spending all this money and they're desperate, a lot of them, because they're sick.
Yeah, I couldn't agree with you more. And that is just reprehensible.
And on that same side, there are surgeons. I have patients of mine. I had a patient of mine who had implants I put in maybe 15 years ago. And she thought maybe she was developing BII. I saw another surgeon because her husband was seeing this doctor. And that plastic surgeon told her when she said, hey, I've got these symptoms. Do you think it's my implants? And he said, let me give you the number for a psychiatrist. That's literally what he said.
That's rude too.
So on the same side, you got these other surgeons who are like not taking their symptoms seriously. Part of it is because is it because they're women? It's possibly, it's not a good situation.
Not at all. What do you think about the use of AI? Where do you think AI is going to play a role in surgery? Do you think that it will allow patients to have better outcomes, to see exactly? Do you think that there's?
I think that outcome, and we're doing that already. We're using 3D printing and stuff like that to try to predict outcomes. We've been looking at that for plastic surgery, and I don't think that there is a lot there with AI just yet. I think with other types of surgeries, robotics are huge. When you're doing when you're doing surgery inside the abdominal cavity, and you're doing it with the tiniest incisions and using robots, I think that's one thing. But with the procedures that we're doing, really what it comes down to is when you're looking at, here we've been talking about non-invasive ways to turn back the clock. When do you need surgery? The main time you need surgery is when you've got a lot of excess skin, because there's no injection, there's no food you're going to eat or cream or whatever that's going to make loose hanging skin go away. You just have to cut it out. And we're never going to be able to get rid of that skin without cutting it out. When you cut it out, you create a lengthy scar. You're never going to be able to heal without a scar because that's how our bodies heal.
Right.
But I think where we're going to get to eventually is we're going to get to scar treatments that will help to really minimize them very consistently, but we're not there yet.
So we don't have major treatments for scarring.
Nothing great. And AI, I think, the fact is that the one thing that we would love for it to be able to do is give us novel approaches to get rid of problems that we have. Well, the big thing we want to try to get rid of is excess skin because that's what always necessitates surgery. How's that going to do it?
And yeah, that totally makes sense. I was just thinking in terms of AI, it again shows you the 3D rendering.
But that also gets dangerous because now you get patients who bring in these AI or these even just filtered pictures of themselves. Like, this is how I want to look like. And then there's little things that people don't realize is that if you've got a smartphone and you're taking a selfie, studies show that selfie will make your nose look 30% bigger than it really is.
What?
Yes, 30% bigger. And so some people, they're taking selfies, they're like, I want to get a nose job. And it's like, no, it's because it's your phone's making your nose look 30% larger than it is. Take a picture from 5 feet away with the rear-facing camera, then see if you like your nose, because you probably will like it a lot more.
All of that is really good advice. When you were writing your book, again, people have to understand and recognize it takes years to write a book. Was there something that you came across that you weren't expecting from even a recovery aspect or just a science perspective?
I think when I wrote it, the thing I wasn't expecting was that it would turn into this program that really worked for people. Okay. Because when I started writing it, it wasn't for me to create because I've got something in the book called the 21-Day Jumpstart. And it was something that I created after really writing the book. So I wrote the book because I'm like, look, there's so many things you can do with food, with intermittent fasting, with skincare that can really help turn back the clock. And what I ended up doing is compiling a lot of those into this 21-Day Jumpstart. And I'm like, well, let me create this. We'll test it on some people and see what happens. And so in this Jumpstart, it's very simple. It's 3 weeks. The first week, essentially, it's cleaning up your diet, getting you on a limited array of very specifically chosen supplements. And these are nothing crazy. Collagen is the only one that's even at all controversial. And then putting you on that 2 minutes, 5 years younger skincare regimen. And that's it. So the first week, cleaning up your diet, increasing the amount of healthy proteins, healthy fats, getting rid of ultra-processed foods, sugars, all that type of stuff. And then the supplements and the skincare. And then weeks 2 and 3, we incorporate intermittent fasting into it. And then what we did was after doing a lot of studying on intermittent fasting and its effects on autophagy and all of that, I started realizing that there are certain foods that can promote autophagy even though they may break your fast. And so eating basically healthy fats and then polyphenol-rich foods appear to help stimulate autophagy even though you break your fast. So what we ended up doing is then for the weeks 2 and 3, we had very simple, just for 2 days a week, they would intermittent fast 16 hours. And then when they would refeed at noon on their refeeding day, we would keep them on essentially a healthy keto diet, where it's healthy fats, essentially lower amounts of protein and carbs. And then after 3 weeks, we would see how they did. And we tested on a relatively small number of people initially, and they did great.
Were you testing HSCRP?
We weren't doing labs, so it wasn't like an IRB study or anything like that. It was just like, hey, let's do questionnaires and stuff like that.
How are you doing? Yeah.
And then I put it out there for 10,000 people that we did it on, and what really surprised me was, because I wasn't sure if it was going to work, and the amount of changes that people got in their skin, where they would say, look, I went out to dinner with my friend and I'm doing this, and they're like, wow, what are you doing with your skin? Not knowing they're doing this Jumpstart. Or people who found that they had improved their energy significantly, or they found really universally, people said my energy level is through the roof. And then a lot of people also lost weight that they wanted to get rid of as well. And so really, I think what surprised me was oh my gosh, it worked.
I mean, I love when that happens, when you read a bunch of research and literature and then you bring it to the bedside and you're like, this is amazing.
Let's see if this works.
I can't believe that this
So
worked.
we did on our smaller number for the book. And then once the book came out, I did a group of 10,000, and it was the same thing. It's people just all saying, man, this is so great. And it was easy. And this isn't like biohacking where you're taking 50 pills a day and stuff like that. No. This is simple, lifestyle changes. And people are saying, look, I don't feel restricted in any way. I feel and there's no calorie counting. You eat, this isn't, a restrictive type of a thing, but just really making those changes can make huge, huge changes for your body.
I love that. Where do you think the field is going? Where are we going?
With all of this, I think where we're going is realizing that there truly is a lot of value to preventative health and to what we would consider alternative health. Alternative health is going to become mainstream, and it already is. There are people like yourself, people who are also more on the traditional side, who are really kind of slowly dragging the traditionalists this way. I had a friend of mine who's a prominent dermatologist in New York City, who has been for decades, and I did her show not that long ago, and we were talking about autojuvenation and using food and skincare, and she was like, food is medicine, Tony. And I'm like, oh my, and she's like an NYU Langone professor and everything like that. These are things that you and I and our friends have talked about years ago. And I think it's our responsibility, people like you and I who are board certified, we're physicians, to bring this to the traditionalists, and gradually kicking and screaming, they're going to come along. It's just because they know it's right. Yeah.
I couldn't agree with you more. And I love this idea of auto rejuvenation. I'm so happy that you came on the show.
Thank you, Gabrielle. I appreciate it.
Very, very happy. So much fun. Where can people find you?
So I'm all over social media.
All over. By the way, when he says all over, I think your YouTube has at least
5 million subscribers. Yeah, 5 million. It's
5, and you will get lost in the rabbit hole of
it's a lot. Yeah.
Surgery.
So the book is Younger for Life, and we have a website, autojuvenation.com, where if you buy the book, we have a bunch of free gifts, including a companion recipe book, $30 gift certificate to my online store, Youn Beauty, because we do sell natural and organic skincare products and supplements as well.
Do you know, I didn't receive any of those.
You didn't? You have to sign. Go to the website, autojuvenation.com.
Okay,
I'll send you some myself. You don't have
those.
Yeah.
Yes.
Yeah, I'll send you some. Yeah, I should have a long time ago.
I think what you're doing is great. And I love that you are a well-trained surgeon who is thinking about things outside the box.
Thank you.
And you just make the world better. So thank you so much for coming on.
I appreciate you. And I love where you have come from, because many years ago when we first met, we were in very different places.
That's right.
It's great to see how far we both come.
Yeah. Thank you, friend.
Thank you.